In the run-up to the UK election, we want to use this time to take you through our oral health manifesto point by point. We hope that policymakers take this opportunity to brush up on their oral health knowledge so that they can better equip the country with what it needs. Right now we're going to be talking about integrating oral health and general health. We talk about this a lot, Karen, don't we?
We do talk about it a lot, but you know, it's really strange, isn't it, that people do think of the mouth as being a complete separate entity to the rest of their body. But it's really funny, isn't it, that not only do we have robust evidence that shows that all of the conditions that you've mentioned are linked with poor oral health, but things can be diagnosed through the mouth. I mean, you can get Crohn's disease in the mouth. So you may not know that you have Crohn's, but a dentist could spot it for you. Now, that's amazing, isn't it? There's other things, dry mouth. Your dentist will see that you've got a dry mouth and they may be able to say, are you taking certain medications? Maybe you need to see your GP. There are lots of other things, persistent ulcers. That could be a low immune system. There's lots of things that the mouth can tell somebody. It's a mirror of your body. So it's really, really important that we think of it as a whole thing. And everything starts with the mouth. If you think about it, everything that we put in our body starts with our mouth. So we've really got to make sure that that is in tip-top condition so that we can be healthier and healthier for longer, and keep ourselves as happy and
As healthy as
less
possible.
of a burden on the health services, because a lot of these things, and I would say there's probably other things that we could probably say start in the mouth, but these things will come to light over time. There's millions and millions of bacteria in the mouth, and most of them are good bacteria that we need. Some of them a little bit more naughty that we don't want in the mouth, that can cause gum disease, also dental decay. So those are the two main things that we're looking at, when we're looking face value at, excuse the pun, when we're looking at face value, looking at our mouths. Obviously, we all should know by now that we are brushing our teeth last thing at night, 2 minutes, with a fluoride toothpaste, and cleaning interdentally once a day. So that is our mantra. That's what we know we should be doing. Now, we need to visit our dentist regularly, as often as they recommend, just to make sure that everything is ticking along nicely. Dentists are not there just for when somebody has a problem or has pain. Dentists are in an ideal situation because it's really the only place we go when we're well, because we only ever go to our doctor when we're ill.
You're right.
Whereas,
but they want to see you when you're healthy.
Well, they want to see you when you're healthy, but they don't want to just see you when you've lost a filling or you've got toothache.
Yeah.
There are lots of other things that they need to check. And as I say, because the mouth is a mirror of the body, you can pick up other things there. And also, if you do have any of the problems that we've listed, diabetes, heart disease, you're at risk of stroke, it's really important that you have your gums, etc., checked to make sure that you haven't got gum disease, which will exacerbate these problems. Now,
absolutely,
whether this is, picking up and working, dentists working with doctors, working with the referral system. So we're knowing the whole holistic treatment of somebody from head to toe, basically. Yeah. And obviously the mouth somewhere in the middle, but
well, it's quite near the top, I suppose.
Well, it's near the top,
literally, I guess. Yeah, but the this has come a little bit further, I think, than in some areas of the country than others. Like I saw through Smile Month, there was one community dental team that they had integrated the dental care into the spine system, like the NHS spine system, which is basically their like any requests that get sent through the spine. So the fact that dental is getting integrated into that is a huge step forward in this integrating oral health and general health. But from the dental side, I had to re-register at my dentist, and the amount of questions I had to answer about my whole health history, everything I'd ever did. I stub my toe 10 years ago falling down the stairs, like, and I'm putting things on there that to me don't seem relevant. And so the majority of people probably don't seem relevant, but they 100% are. Because
Yeah.
like you say, a dentist can look in your mouth and go, I can tell that you're
So
asthmatic. Like, you know what I mean? Like things that you would
um,
never normally
they,
think.
they wouldn't bother asking them unless it was pertinent to your care. It's really important, obviously, they know if you're allergic to anything, if you're taking any medications, if you've got any existing conditions, because that will all help them decide how they're going to treat you. As I say, when you're seeing your dentist, often they will say, are you seeing a specialist or a doctor? And, they can liaise between the two. Obviously, you need to give them permission, but it's not unheard of for a dentist to speak to a doctor and say, I want to treat this patient. Do you think that that's going to be fine? They're taking this, they're doing that, etc., etc. So that's it. But another really, really important part of the healthcare system to get involved is pharmacists.
A
They
hundred percent.
they are
Yeah.
really good. If you can't get to see your dentist, but you're asking about something in the mouth, go and see a pharmacist. Have a chat with them. If they think you need to see a dentist, they will tell you need to see a dentist. But they can help so much, and it's about using every one of every one of the people in our healthcare system, and for them to put you on the right path. Because sometimes you don't need to see a dentist. Sometimes you might need to see a doctor. Sometimes you might need to be referred into the hospital system. Sometimes you might need to see a pharmacist. And all of those things need to work together. And then that's the key to getting overall smooth running machine that will, in the long run, help the whole of the NHS system just work a little bit better. Doing the right thing for the right place, and getting a healthier society at the end of it, because we're working together to try and eradicate all of these issues that can be started in the mouth.
It will improve your health without you having to really do anything
We
because
need a
it's all being done
system.
behind the scenes. Yeah.
Yeah, yeah. So putting them both together and making sure that the left hand knows what the right hand's doing, and starting it in the oral health part of the education. So ensuring that everybody does know that gum disease and the bacteria, the bad bacteria that we were talking about, sometimes goes awry and can lead to other, sometimes very serious conditions. It's really important to remember that.
Read the full manifesto on our website and get in touch with your local counsellor to see what they're planning to do to improve the oral health in your area. Next time we'll be discussing boosting the dental workforce.